Hello, my name is Ryan Sikora, and today I will be talking about databases in the health field. So first of all, a database is a collection of information that is organized so that it can be easily accessed, managed, and updated. So some of the advantages to using a database are that it's easy to update and manage large volumes of data. It prevents garbage in, garbage out by allowing data entry restrictions, and queries allow you to slice up large tables to neatly present data. And some of the disadvantages to this are that it takes more training for people to use it proficiently. So right now we are looking at the inside of a database, and for example purposes I just took a sample database from this program where we have a bunch of just customer information. So we have just like the customer ID, its first name, last name, email, and some other somewhat useful information. But let's just say that our boss doesn't exactly want all this for us, and the great thing about databases is that when I look at this next page, I was able to make a code so that I could just have the first name, last name, and our email to display, which takes out all the other information that might not be as useful for the time being. So a problem that clinicians face is that they need to have an abundance of data on different kind of diagnostics, prognostics, therapy, and prevention. However, old school sources are pretty unreliable because they can either come from old textbooks or experts who are often wrong in their research. So one of the solutions that has been found is using a clinical decision support tool, which is a database that can cut down on how long it takes to deliver accurate information in a timely manner. And because of this, physicians are able to answer a clinical question in under 2 minutes sometimes. There are many different types of clinical databases. The first one is an operational database, which contains a patient's live electronic health record. This is used during patient care for many things like healthcare provider orders, laboratory tests, and nursing documentation. Another one is a clinical data repository, which is a software that collects, combines, and organizes data from operational databases. And much of the data that is in these include past medical records, medications, demographics, and admission and discharge dates. And finally, we have our data warehouse, which is used for more of a long-term storage or analysis, and this has many years of data that can be queried for different clinical or management reports and other research. So looking at ClinEGuide, this is a clinical decision support tool that recommends different treatments by providing access to leading sources of drug information and peer-reviewed evidence-based medicine. When asked in a survey, 72% found that this database was pretty easy to learn how to use. 94.6% of the people found that the information was relevant to their needs, and 84.8% of the people would recommend this product for their library. So obviously you see that this is definitely helping out many different people in their jobs. Also, ClinEGuide has a mobile version. It is less powerful, but it still has a variety of features like a 5-minute consult and an A to Z drug facts. Although clinical decision support tools can be very useful, sometimes they can be a little difficult to use. Although 72% of the ClinEGuide users that were surveyed considered it easy to learn, only 59% or a little less than 2/3 of the people thought it was easy to use. And also another part is that different places will have different clinical decision support tools, which can be very frustrating, especially if you're transferring from one job to another, having to learn the new system and everything. But if we can really look past these flaws, clinical decision support tools have made a great impact to the clinical side of healthcare.